We are all worried that there's going to be a fourth wave. As you have already seen in the last year, we've had 3 waves already, and each time the waves went down, everyone became very excited and took their masks off and stopped doing all the precautions that we recommended. At this time, it's the same thing. People are getting excited. It's the spring. People are taking the masks off, and everyone is impatient. Everyone is impatient. We all want to get back to our normal lives. But the recent data has shown that there's been a slight uptick of the number of cases. And the most worrisome thing that has happened in the last few days and weeks is that the variants have increased substantially, particularly on the East Coast, the Midwest, and the Sunbelt areas. That this is the concern that we have, and that's the reason why we have to continue wearing our masks and also doing the social distancing and hand hygiene. And what the data shows us is that these vaccines are extremely safe. And not only that, these vaccines are very effective in preventing COVID-19 and particularly preventing people from getting into the hospital or dying from this. So these vaccines have really proven themselves in terms of their effectiveness and their safety. What we mean by herd immunity is that most of the population or a large percent of the population is protected against a certain disease. So that herd immunity you can get from natural infection or you can get from the vaccination. So based on the fact that we've had only about 20% of the population vaccinated, although we have had about 30 million plus people who've had COVID-19 infection, we're nowhere close to what we consider herd immunity. And what we consider good herd immunity at a level that's going to be helpful to turn this pandemic around is about 70 to 80% of population has to be protected, and we're not anywhere close to that yet.